I'm Dr. Sujith Kumar Mullapally. I'm consultant medical oncologist at Apollo Proton Cancer Centre. The treatment options for cancer previously was limited to surgery, radiation and chemotherapy. But now we have something called as systemic therapy. Systemic therapy includes not only chemotherapy, but it also includes targeted therapy, immunotherapy and endocrine therapy or hormone therapy. The reason why we have this advancement is chemotherapy has many challenges. The side effects of chemotherapy are one reason many patients do not want to come forward for treatment. Although chemotherapy is still the most important treatment option, but there are other options like targeted therapy. Now the reason why targeted therapy developed is the understanding of cancer, that cancer develops because of some mutations or molecular alterations that happen inside the cell. The scientists tell us that there are numerous very important mutations, like in lung cancer we have something called EGFR mutation, which drives the cell towards becoming a malignant cell. So in adenocarcinoma lung, it said about 70% of patients have mutations, and if we are able to detect these mutations by tests like next generation sequencing, we are able to give them treatment based on that target. The other part is immunotherapy. Now we all know immunity and cancer is related. In patients who have immunity issues like patients with human immunodeficiency virus, patients having uncontrolled diabetes, and patients especially elderly patients who have their immunity low because of physiological reasons, the incidence of cancer is high. So that is because the immunity in their body is not able to prevent cancer cells from growing. Even in a normal person who has good immunity, the cancer is not stopped by our own immunity, because the body does not recognize the cancer cell as bad cell, because ultimately cancer cells are our own human cells. So there is a brake on the immune system at the initial stages of cancer, which prevents cancer from progressing. So immunotherapy is a way where we give injections which release this brake and allows the human immunity to fight against the cancer cells. And the most common drugs which we use are technically called checkpoint inhibitors. So there is a checkpoint of immunity against cancer which is released or inhibited by these immunotherapy cells. The most important part is currently the treatment of cancer is revolutionized by the immunotherapy, and most of the cancers like lung cancer, skin cancer like melanoma, even in patients who have advanced cancers of kidney, immunotherapy has become the first line of treatment. And whether it is possible for every patient, regarding the eligibility for patient, it is not like that. Most of the times we have to do a specific test which we call as PDL1 test, which helps us to know whether the patient will benefit with immunotherapy. So the decision making, so many times patients come and ask us whether we can start immunotherapy because of they would have heard about immunotherapy being less toxic than chemotherapy. But we always explain that the decision of treatment always depends upon each person, and it's not a common prescription for everyone, and which is called as personalized treatment. So if a patient comes to me after the biopsy, after the staging with a scan, I do tell them to do the molecular test. I do ask them to do the PDL1 test if there is a immunotherapy option, and ultimately there is a personalized treatment option, which may mean that chemotherapy is the option, or targeted therapy, or even combination of these treatments. So that would be decided by the treating oncologist, and that is very important to understand. Regarding hormone therapy, we have something called endocrine therapy in breast cancers, where after the main treatment of surgery, radiation and chemotherapy, patient is asked to take tablets for 5 years or 10 years based on their stage. So it helps to control the disease, and it really helps to cure the disease also. The challenges of chemotherapy is that patients and their families do fear chemotherapy because of its side effects. Apart from affecting the target organ or the target cancer, it also has effects on the body, especially on the blood and systems like the gastrointestinal system, which can cause diarrhea, oral ulcers, and also in blood it can cause reduction of platelets and WBCs. The most important thing we need to understand is, as the cancer care has advanced, along with chemotherapy we have better supportive care. We have medicines to improve the blood counts which are given after chemotherapy. we have medicines to prevent side effects like diarrhea, but still many of them do have this. In this context, it is important to choose chemotherapy or other options like immunotherapy and targeted therapy, and the revolution that has happened in medical oncology is that many of the cancers can now be treated. It has been seen that many of the cancers have molecular alterations or mutations in their cells which drive the cancer forward, and this has revolutionized the treatment with the introduction of targeted therapy in lung cancer, in cancers like kidney cancers, in blood cancers like CML. We have targeted therapy which are more important and more useful than chemotherapy. This has been the advancement of the last decade. Many of these medicines are oral medicines and they have very minimal side effects when compared to chemotherapy. Previously, targeted therapy used to be very costly. Still many of them are costly, but since last 5 years we are having Indian companies who have produced generics which have been tested and proven to be as useful and effective as the innovator brands. So this has brought down the cost and this has improved the affordability, and many of the patients who come to us for treatment are able to afford the treatment based on the proven beyond doubt that use of yoga, doing yoga practices during treatment and after treatment does help in improving the quality of life, reducing the stress during treatment, and even may have effect on the benefit of cancer chemotherapy or other treatments on cancer. So it has been proven recently that the improvement in survival also is there, although it was not very significant, but there is an improvement in survival also. So yogic practices do not only mean the practices of the body, it also includes mindfulness, it also includes breathing exercises which may be possible by patients who even have advanced cancer. So in patients who have bone metastasis, it may not be possible to do complicated yogic postures, but breath exercises and mindfulness and meditation will definitely help. Coming to the alternative or complementary medicine systems like Ayurveda and Siddha, it is not proven that using it along with chemotherapy or other cancer treatments is useful. We usually don't advise it because there is no proof, and on rather we actually as doctors we fear using of treatment like Ayurveda or Siddha along with chemotherapy might increase the side effects of the treatment, because all these medicines have their effect on liver and the metabolism of chemotherapy drugs get changed. It might be increased or decreased because of these medicines, which may reduce the effect of the treatment or may increase the side effect of the treatment. Regarding music therapy, there are evidences that having music therapy or art therapy can help patients to go through the treatment in a more relaxed way, and we are studying that aspect in our hospital with patients on chemotherapy are being given music therapy and the effect is being recorded scientifically.